and welcome to another edition of Potluck, your everything and anything talk and entertainment TV show. Today we have a very special guest joining us who has straightened up probably a bunch of people and made them feel better. He's a chiropractor and physical therapist and owns Smart Medical in Maryland. His name is Dr. Alan Cornfield, and so welcome to the show, Alan.
Good afternoon, how are you?
Good. So how long have you been in practice?
A long time. I graduated chiropractic school in 1987, so I started in May of 1988. So I guess 27 years.
Okay.
It's a long time.
So when did you decide that you wanted to go into chiropractic?
Well, I was at the University of Maryland, and I was a business major. And every year, from the time I was 14, 15, I always had back problems. And the back problems would get worse, and I'd go to the family doctor, and he'd say, take these pills, lie down in bed. And I said, okay, if you get out of bed, you might need surgery. And okay, and I'm looking out the window, and I see all these kids playing. I said, wow, this is awful. And then I went to again, I was at the University of Maryland, and all of a sudden my back had a problem, and I couldn't walk. I remember I had to take anybody who went to Maryland will remember Math 110, because we all took it. And I was taking my Math 110 final, and my friends carried me in on a board.
Oh, wow.
So I couldn't sit. So I took the final, sitting upside down. They put me in a car. I drove back to Long Island, and my mother said, okay, we'll go to a chiropractor. Because I said, the drugs don't work. Not that they don't work. They weren't working for me.
Right.
And I went to a chiropractor, and 3 weeks later, changed my life. And he said, why don't you do this? This guy's name was Dr. Stanley Kramer. And Dr. Stanley Kramer said, why don't you become a chiropractor? I said, I don't even want to be in college. I said, I can't take any more. I said, I've never taken a science class. He said, give it a try. So I did, and it changed my life. And I owe that guy so much.
Wow. Because
I thought it was the coolest thing that in 3 weeks, I was able to touch my toes for the first time in my life and be out of pain. I just thought pain was a way of life.
Right.
And it didn't have to be like that.
Wow. So now you own several practices. How did you get started with the first one?
Well, I'd worked on Long Island for a couple of guys, and they ended up not paying me. After 6 months of working there, I said, well, this isn't going to work. I was waiting for my Maryland license to come in the mail. I came down as soon as I passed the test, and I had an uncle who was a real estate agent. He found me a house on Colesville Road, not 29 in Fairfax, but 29 in Maryland.
Right.
Spine 29. So, and my father helped me purchase the house, and who was living there but a chiropractor? And his name was Dr. Voigt. He gave me his practice. It was a small little practice. Believe it or not, back then he was only charging $10 a visit.
Wow.
And when I was making $500 a week, I thought I was a millionaire. Who knew?
Right.
Who knew that you really can't survive on that kind of money? And about a year after that, my father passed away. And I said, time to get serious. So I started marketing the business. Somebody who was a student patient of mine, a Dr. Loeb, came to Maryland. He said, open me up a practice. So I said, wow, this worked for me. So I bought another house 10 miles away. I put him in practice, and he was there till 2 years ago.
Oh, wow.
And I had sold him the business. And then I had opened one up in Seven Corners, Virginia.
Oh.
And that was a Dr. Camille D'Amato. She's still in practice there, and I had sold her the business. I said, wait, what are you doing, Alan? Why are you selling these businesses? They're all going well. So I started opening up, and I opened one up in Gaithersburg and in Oxon Hill. And they're still around. That was about 1997. And somewhere around 1997, another doctor came to me and said he was thinking about moving to California. Would I buy his practice? So I did. So all of a sudden now I went from, I only wanted one practice because I kept selling them, to now I had 4. And then about 7 years ago, somebody asked me to open a practice in Frederick. So then there's Frederick, so now there's 5 practices.
Okay.
And 3 years ago, I know those are hard to follow, I had a doctor that had worked for me in 2000 to 2003, Dr. Glenn Berkeley, came back to me and he said, Alan, I don't know how you do it. I can't run the business. I'm going to give you my Bowie practice. Please rehire me. So now I have the 6 offices. And that's how it grew. But being a doctor is much more fun than being a business owner. It's not even close.
Right.
There's no thrill you get like from treating people and helping them without medication.
Okay. Now, your practice is different because you have an acupuncturist and you also have an orthopedic doctor. Normally, when you go to a chiropractic office, they have, a lot of chiropractors are physical therapists as well. But you have an acupuncturist and orthopedic.
Well, in Wheaton, which is the main practice, that's the center, that's where I work out of, we have a Dr. Meow. She's been with me about 6 years. And Dr. Meow also has a license to do acupuncture.
Okay, so she's a chiropractor
She's a chiropractor and an acupuncturist.
Okay.
In Frederick, there's actually a separate acupuncturist that rents space from us.
Oh, okay.
And it all goes along the same line. Now, I don't have an orthopedist any longer.
Oh, okay.
For a number of reasons, he's no longer there.
Okay.
And I hired a neurologist.
Oh, right.
Because I like working together with the medical profession, because it's really not about chiropractic or about medicine. It's about the patient. And it always has to be about the patient first and doing anything you can to help out the patient. So if we could help them, great.
Sure.
If they need medication, that's okay too. But we try to work together for the benefit of the patient. And it's been a terrific path.
Okay. Now, is chiropractic for everybody?
Yes. Almost everybody.
Right.
But we don't cure everything. Like, one of our teachers, Dr. Giacomo, used to say, the only thing man can cure is a ham. But no, we can help. Actually, with chiropractic, the word chiropractic means to practice with the hands. And we correct spinal misalignments or any other misalignments in the body. What we do is we treat what's called subluxation. Now, in the medical term, subluxation is different. But it's basically when a bone, usually a vertebrae or any joint in the body, is out of place, and it's not moving properly, and it's causing nerve interference. Nerve interference is usually going to be radiating pain down the arm, which many people have felt, pain down the legs, which a lot of people have felt, but it could also be a muscle spasm, pain, hot, cold. So chiropractic, we go to school for many years to learn all about the body and how to help people out. So there are people that are coming in with babies. There are people that are coming in with all kinds of different problems. And we're also treating geriatric patients, some of the older patients. Treat athletes. So is it for everybody? Almost everybody. I'm not going to be able to help somebody with a broken bone. Can I help what goes on around it? Yes, but I can't help the broken bone.
Okay.
Am I going to cure cancer? Absolutely not. Can we help somebody be more comfortable or having side effects of different kinds of cancer treatments? Yes. You try to make people as comfortable as possible.
Okay, but also for well-being as well? As I know, like when I went to a chiropractor, who I went to for years, it was more about maintaining health style or maintaining your health.
Yeah, a lot of people. One of my roommates from chiropractic school, I went to school at New York Chiropractic College on Long Island, and one of my roommates has a wellness practice, and we talk all the time. And we have 2 totally different practices, but our goals are the same.
Okay.
I like treating people and then setting them on their own and giving them exercises and saying, come back when you feel you need me. He has people come back weekly, monthly, or every few months.
Right, right.
It's a different philosophy, but the idea still is to remove subluxation, remove nerve interference, and to help the patient move freely.
Okay. Now, some people are afraid to go to chiropractors.
Yes.
Because people always hear bad stories, like that they are damaged for life. And
what a pet peeve! I'll tell you, this is what I've been hearing forever. I'll start at the end. My malpractice is so inexpensive. I love to write that check. It is believe it or not, $1,200 a year.
Oh, wow.
If we were hurting people,
It would be a lot more.
the insurance would be much higher. It's not set by chiropractors, it's set by actuaries. So we're not hurting people. In different states, it might vary a little bit. Is there a risk? Yes, but that's why you do a proper exam. That's why you make sure there isn't a broken bone, or somebody might have osteoporosis and you have to be much more gentle.
Sure.
You try to examine, find out what's wrong. Is it bone problem? Is it a nerve problem? Obviously, everyone's heard the word discs. And when I treat people, I always tell them after the first visit, doesn't matter to me if you get better or worse the first day, as long as I make a change. I'm looking to make a change. And I always use the example, if you go to work out in the gym, it's going to hurt the next day. You're going to be sore. So we're moving things that aren't used to being moved. But most people, I mean, it's over 90% of the people get positive results, maybe 98%. There are people we can't help. That's why I work with medical doctors, and I send them there. But are people scared? Yes, they not used to. Obviously, people know that when you get an adjustment, there's a noise associated with it. And especially when you see it in the neck, it doesn't look so good to look at it on, you know, face to face. Everyone goes, ooh, and they make a face, but it doesn't really hurt. It actually, wow, I can move my neck. I can turn from side to side. What happened to the pain? You know, so you're putting things back in place, and that's from realigning the joints of the body. That's the noise that it makes. Also, the side effects are almost none. There's almost no side effects. It's terrific. I don't know why anybody would be scared. Interestingly enough, a story that happened last week, I have a lady that helps me in my house. She helps clean my home. She comes, she goes, Alan, I think I'm going to have to be done. I'm going to get back surgery.
Oh.
And I said, you getting back surgery? You didn't talk to me? She goes, I'm afraid of you. I said, wow. I said, so you asked me to work here. You also wanted to work in my clinic as a therapist, because she's licensed in her country as a therapist.
Oh, wow.
But you're not afraid to get surgery? I said, surgery should be a last resort. Even the surgeons that I talk to, they'd rather not operate on people because the success rate is limited.
Right.
Because you're limited by people's age, by people's weight, by people's compliance. It's not easy. And you know, once you open the body and you change the body, it's changed forever. So as a chiropractor, I try to get people to work with the body they have. Try to get them to exercise. I used to do a radio show years ago, and it was called Life is Motion. Keep moving, and you'll stay healthier.
Okay. So did she end up having the surgery?
So she came to my office just last week, and she goes, I'm scared. I'm coming back next week. I don't know what, I don't think she'll show up. I think she'll go for her surgery, and I hope she gets better.
Okay.
And I'd love to help her. To me, I take it like a personal challenge.
Right.
I play a lot of sports. A lot of the guys I play ball with, I play basketball, people are always getting hurt. Some people are afraid. They don't know, they don't have a reason. Many other people, they come to my house, they come to my office, and they say, wow, this is the greatest thing. So they're always calling me.
Right.
Can I come over? Can I come over? I said, well, you got to come really early in the morning before you go to work. Because if they come to work, I'll end up talking to them all day long.
Now, most people don't understand that you're also a physical therapist, so you can do the same thing as like a regular
Well, I'm not a physical therapist. I have physical therapy privileges. I learn everything about it. Physical therapists do a terrific job, but they're not doctors. And usually what they don't do is diagnose problems. And I feel bad for them because they do a great job. They tip, not all the time, but quite often they work for orthopedists.
Sure.
So they're working underneath an orthopedist supervision. And they actually do most of the treating, and they help people post-surgery. You know, they'll help them with weights, they'll help range of motion, they'll help strengthen, and we try to do a lot of similar things, but it's definitely a separate profession.
Okay. Now, what have been some of the challenges along the way for you since you started this?
Oh my God.
Or like, what has been the most challenging challenge?
The most challenging challenge, okay, was originally, I had a small little practice, as I said, from Dr. Voigt, and people coming in, I was treating them. And then after my father died, I started going to lawyers and marketing myself and saying, hey, I can get people back to work faster and in less pain and for less money. Trying to work with people who get hurt at work, people who get hurt in automobile accidents, people who might just slip and fall at work or at a supermarket. And that's how I developed the business, and it worked very well. And the people are getting better faster and for less money, and they're happy, and a lot of the patients want to come back. But my biggest personal challenge, because I'm not the greatest manager, I have great vision to the future. I like to think I'm a good doctor, but managing is a problem. So keeping staff as you grow, you don't only have one staff member, all of a sudden you have 5, 10, 15, 20, 25 staff members trying to keep the staff, not being a great manager, trying to keep them happy. The doctors, of course, after a few years are working with me, and then they want to go out on their own, and I don't blame them. But replacing a doctor into an office, making sure that they use their hands properly, that they're doing a proper exam, because I want to have a basic philosophy within the office of helping people out and using chiropractic the way it's meant to be, by hand. You know, using adjunctive therapy, which would be hot packs, cold packs, traction, electrical muscle stim, ultrasound. Those are all good parts. They're adjuncts to the practice, but the main thing has to be to use your hand. And if a doctor doesn't use their hands, it's hard for me to keep them on board.
Now, when you hire these chiropractors, do you get adjusted by them to see how they are, or how do you kind of test the waters? That's
part of it. Actually, I do. It's funny you would ask that. It's funny you would ask that. I like, first of all, when I meet somebody, I can tell very quickly about their personality. I don't like to have people that are too shy. Well, there's nothing wrong with it. I want them to be able to communicate with the patients, because chiropractic is more of a physical relationship, unlike you think of the medical doctor with the white coat and the stethoscope around his neck and how are you feeling today? Okay, you know, that's what everybody's vision is. But I want to have a more friendly approach so people feel very comfortable telling you what's wrong. You know, not only if they got hurt in an accident or playing sports, but what happened to them years ago? What limitations do they have? Or since you've had this injury, I want them to ask the right questions. Like, can you take out the garbage? You're only 32 years old. Do you have small children? Oh yeah, I can't lift my child. These are little things that come up by asking people the right questions, and you want to get them back to a normal lifestyle, or the lifestyle they were used to prior to their injury.
Okay. Well, very cool. So let's talk about more of the positives of chiropractic. I've seen stories where people have, regained eyesight, or they've been able to walk again because of chiropractic. Have you had any miracle stories in the years that you've worked?
Well, my first miracle story was way back when I first started. I had a lady who since passed. She passed like a week before her 100th birthday.
Oh.
Her name was Rudy Johnson. I loved this lady. She used to invite me to her house, and her husband played the piano in a bar until he was like 80-something years old. And somehow this 28-year-old guy became friendly with this lady who was in her 80s. And she used to come in every Tuesday. But when I first met her, after the first visit, she decided not to come back. About 2 months later, she comes in. She goes, "Okay, Dr. Allen, I'm going to give you a try." And she had a disease called Paget's disease. It's a bone disease. And I started treating her. I wasn't treating her for that. I was just treating her because she had misalignments, and I was trying to fix them. She goes, "It's a miracle. The Paget's disease went away." I said, "Please don't tell anybody that." About 10 years later, she has cancer.
Oh, no.
And they told her she had 6 months to live. And then she goes, "It went away." I said, "It's not me, it's you." But there was a couple of times where, I don't know if it's me. A lot of people have migraine headaches.
Right.
It's incredible. By treating the neck, I call it the cervical region, and increasing or changing blood flow to the head, many migraines
go away.
Here's a funny story. I had a dog that I grew up with. Her name was Bib. And so Bib, when she was really little, ran into a tree. And every month she had an epileptic seizure. And the same doctor, Dr. Frank DiGiacomo, and we're in the second semester of school, and Dr. DiGiacomo was telling us, you could help epileptic seizures. And I'm thinking, there's no way. But I figured what I got to lose, it's my dog. So I took her head and I adjusted her. Her neck moved. She never had another seizure.
Wow.
I know you like animals, so it's a good story.
Yeah. Have you treated any humans that have had seizures, or that you know of?
I had made an offer to a girl who had epilepsy. So I was curious, but I don't want to use people as experiments.
Sure.
But it's something I'd really like to do. There were people who say, different, coming out of the spine, you have the spinal cord, which is inside the spine, and the nerves go to every part of the body. It goes to the eyes. It goes to the head, the shoulders, the hands. The message comes from the brain, goes to the spinal cord, and goes out to the body. There are people that can't get pregnant. Now, is there medication for it? Yes. Are there surgical procedures? Yes. But there have been people that have told me, after I adjusted their lumbar, which is the lower back down here, by adjusting their lower back, they said they got pregnant. Amazingly enough. Now, it makes perfect sense to me because I could look at a chart and see that there could be nerve interference at that level. So that is a lot of, but I've seen, most of the time I'm seeing people who don't have good range of motion, who have difficulty rotating or turning the neck one way or the other. These are the simple things that I see every day. But the migraine, the headaches, changing somebody's lifestyle, it's a big deal.
So it's a big reward for you.
I love it. I really enjoy it.
Okay. Now, going back to Dr. Meow and your neurologist, how are they tied in with? Do they, or how do they decide when to use acupuncture? Or do you ever come across a patient where, I think you might want to try acupuncture?
I don't like, since I'm not an acupuncturist, I want everybody to be a professional at what they're a professional at.
Okay.
So Dr. Meow, she's treating a patient and feels it would be beneficial to have acupuncture treatment. She could talk to the patient. I let her do it on me, but I don't think it's my place to say they need acupuncture, because it's not. I'd let them see her first.
Sure.
The neurologist, he goes from office to office. So he basically sees many of the patients, either with headaches, radiating pain, weakness. But I make sure that they work, the medical profession and the chiropractic profession work together.
Okay.
So they have to talk about each case, because it's important. Because if the orthopedist, neurologist, general practitioner is doing this, and the chiropractor is doing this, it doesn't benefit the patient, and that's what's most important.
Yeah, definitely. I had that issue after my car accident. My chiropractor insisted that I go to see an orthopedic surgeon, and once I did, they were not happy that I had been seeing a chiropractor for a few weeks, and but I definitely relied on my chiropractor after my accident, because I had gone to them for so many years and they made me feel better.
Yeah.
So.
And you probably actually did your exercises and took your vitamins and did
I did
everything
what I was able to.
You did what you were able to
sure.
do to try to help yourself, because you're only in a doctor's office for a short amount of time. So it's very important that people do exercises every day. At minimum, go walking, do stretches. Because if you ever look at an animal, any animal, first thing they do when they stand up is they stretch. Every animal except humans.
Oh.
I don't know about fish, but I know cats, dogs, horses, they all
Always
do
stretching.
it. Just look at them. Look at a lion. You'll think about it. That's what they do. They stretch. They naturally know something inside the human brain stops them and has them rushing from activity. Take 2 minutes, stretch out, gets the blood flow going. It moves the muscles, moves the bones, stretches out the ligaments.
Okay. Now, you have a website, it's smartmed1.com. chiropractic.com.
Yes.
Okay.
I'm not too good with computers. I don't know much about it. Have people in the office. I don't even know how to download a picture, sadly enough.
Right.
But it's the way it is. I'm old school.
Okay. But people can find you on the internet, on Facebook and Twitter, and
Yes.
you know, yeah, and they can check out your website and see all the doctors that are in your offices to see everything that you do and the history of.
But our phone number is 301-585-2225.
Okay.
Which spells 2225 spells back. How about that? So that was one of my clever ideas 30 years ago. Call, ask to speak to me. I'll always return every phone call.
Okay, and your offices, because I know we're in Virginia, but people go over to Maryland all the time.
Right.
So
they're from Frederick, Gaithersburg, Wheaton, Tacoma Park, Bowie, and Oxon Hill.
Okay.
And people call me all the time. This week I got a call from somebody. He said, "Alan, do you know any chiropractors in West Virginia?" So I got on the phone and I found them somebody who definitely used their hands and helped them in West Virginia.
Okay.
This is what I do. You know, I'll try to find somebody in Virginia, obviously because we're so close and I used to have an office here. I know a lot of the doctors.
Right.
There are some that I'd be more willing to work with than others.
Right, right. Okay. Well, thank you so much for coming on the show today.
Well, thanks. This was fun. I haven't done this in a long time.
Great. And if you're just tuning in now, make sure you catch us on the web at www.potluck-online.org. And we will see you next time. All right.
All right. Very good.
Yeah.
Thank you very much.
You.